Alright, so today we're going to be doing a quick neurological assessment. First, I'm just going to test his alertness and awareness to where he's at. Can you tell me your name?
Chris.
Place where we're at?
Home.
Okay, and what's today's date?
Today is April 2nd.
Okay, very good. Now I'm just going to test a few of his cranial nerves, one being smell. Would you mind occluding one nostril and telling me what you smell in this glass?
Coffee.
Okay, so cranial nerve number one, which is olfactory, was just tested, and there is coffee in that glass, so that's positive to him being able to smell. The next one we're going to test is cranial nerves 4 and 6. What I want you to do is just follow my pen without moving your head. Follow my pen with your eyes without moving your head. Okay. And he was able to do that, and that's just testing for extraocular movement. The next thing I'm going to have him do is we're going to test cranial nerve number 5, trigeminal nerve. I'm going to put my 2 hands on the side of his cheeks. I'm going to ask him to clench his teeth. Okay? And try moving your jaw side to side. Okay. So we had a positive response to that. That as well. From there, we're going to move on to cranial nerve number 8, which is acoustic. For doing this, we're going to occlude one side of one ear, and we're going to say a 2-syllable word that is has 2-syllable phrase to it. And make sure he can hear it on the other side. Baseball.
Baseball.
Okay, so that was a positive response to that. From there, we're going to move on to assessing motor function and gait. And you would assess this normally upon the client entering the room. Just make sure they're maintaining balance, that their gait is steady, and their form is relatively decent. Also, we're going to look for any involuntary tics on his body, anything just very abnormal that we would see. We're looking for atrophy of any, the large muscle groups wearing away, anything like that. On him, I don't see anything like that. From there, we're going to assess the sensory system. We could do this by having him express how his feeling 2 different types of stimuli. For this, we're going to do sharp and dull. First, we're going to use his forearm to assess. Can you tell me what type of feeling this is?
It feels sharp.
Okay. And what about now?
Dull.
Okay. So he was correct in both of those responses, which shows that his sensory system is intact. Next, we're going to move on to assess his reflexes. Reflexes are assessed on a scale of 0 to 4. 0 equals non-responsive, 1 is diminished, 2 is normal response, 3 brisker than average, 4 is brisk or hyperactive. So we're going to assess 2 primary tests here we're going to use. We're going to do the bicep reflex test and then the tricep reflex test. And what I want him to do, I don't have a little hammer. So the first thing we're going to do is the bicep. And all I want you to do is just relax this arm. What I'm going to do is I'm going to hit the bicep tendon. And what should happen is the forearm should relax and the bicep should constrict. And I'm seeing that here with him. So that's a positive response to this test. The next one we're going to do is a deep tendon test for the triceps. Again, just relaxing the arm. I'm going to hit on the tricep. The back of the forearm should relax, and we should get constriction of the tricep. Again, a positive response to that test, indicating that a that we had positive responses and to his deep tendon reflexes, and that will conclude our neurological assessment for today. Thank you.